and welcome to Beyond the Data. I'm Dr. Phoebe Thorpe. We just finished a fascinating public health ground rounds on transplant-associated donor infections. Here with me today is Dr. Zaki from the National Center for Zoonotic and Emerging Infectious Diseases. Thank you for joining us, Dr. Zaki.
Thank you.
In today's session, you presented a lot of very interesting detective work. Tell me, what role do pathologists play in detecting these unusual infections?
Well, working at a public health agency like the CDC, we're involved in a lot of kind of puzzle work or mystery diseases, and we try to figure out what the pathogen or microbe is. Mm-hmm. So we take into consideration the clinical background of the patients or patients, epidemiology, history, if there's unusual flooding, things like mice or what the background is. And then finally, and more important as pathologists, is to look at the tissues under the microscope. Once we do, we're able to identify patterns in the tissue that would tell us, could this be a virus, could this be a bacteria or a parasite? Once we have that, we then use different tests that I've talked about during the session to detect those agents in the tissue. Sometimes we actually have to develop new tests on the go, for example, like hantavirus polymerase syndrome back in the early 90s.
It sounds like there's a lot of collaboration that goes on with these investigations. Is there anything that we could do to improve the collaborations?
I'm sure there is. I mean, it definitely is a multidisciplinary approach, and nobody can solve it on their own, and you have to be talking to epidemiologists, clinicians, laboratorians about what the possibilities are. So it usually involves at CDC working with teams within the CDC across the agency, as well as a lot of collaborators at the state health department or academic institutions or different countries as we investigate these unknowns.
What can you tell me about if you had a loved one who required an organ donation, what kind of screening tests are done prior to the organ donation?
First of all, I'd like to, encourage donation of organs. It's really a gift, gift of life. We have to obviously try to do our best to ensure that the organs are safe for transplant. So the usual procedures is to try to exclude some of the more serious infections, things like HIV, for example, hepatitis, and so forth. And there are different regulations or standards whether you can accept organs from such patients. After that, you look at their background, they have contact with animals, for example, bats with rabies or, raccoons, etc. So, again, the goal is to try to ensure you can't get 100%, insurance, but, we have to really be trying our best to, make sure they're safe.
Sure. And then it seems that that extra details help really narrow down if there might be something unusual with infections in these cases.
Right. But, and usually, the infections that we screen for in donors are common ones really common infections that, like I said, HIV or hepatitis, herpes, with the unusual infections that we talked about today, these are, again, unusual, rare events. And sometimes you can't actually screen for them. You can screen by asking the right questions, again, animal exposures, et cetera, any certain symptoms that the patient, just being on the lookout for anything that could give you a warning signal, and then ask more questions to make sure they're safe.
Thank you very much for joining us.
Thank you.
And thank you for joining us. I would encourage everyone to go ahead and see if they can donate their organs. Talk to their family members about it too. Thank you.